here for my pelvic floor physical therapy session. Hi, welcome. I need your driver's license, insurance card, and credit card to keep on file. Do you happen to have your paperwork? Yeah, actually I do. I brought it in with me all filled out. Some great work. Most pelvic floor physical therapy clinics have your paperwork online, so you can print it off ahead of time, have it all filled out and ready to go. Then you're just walking in, getting copies of your driver's license, insurance cards, and getting the credit card on file. Great, let's head on back. So welcome to pelvic floor physical therapy. Have you ever heard of what pelvic floor physical therapy is before? No, actually my doctor thought it would be a really good idea that I come in and see you, so I made the appointment, looked at everything online, and I really have no idea why I'm here. No worries. A lot of people actually have no idea what pelvic floor physical therapy is, and that's why I'm here to explain it. So if you've ever had physical therapy for any other joint in the body, back pain, shoulder pain, neck pain, what you've done is you've gone there, you've probably stretched tissue that is tight, that can't be stretched out, so we're trying to gain range of motion. You may have strengthened muscle tissue that is weak, and then you've probably worked on stability, trying to get the nervous system to connect with those muscles again and function well. If you've got any scar tissue, you probably have worked that out, but the whole goal is to try to get your function back with activity. So I can see here that we've got some issues with like pain with intercourse or peeing your pants while running and jumping. Those are type of things that I can help you with. Muscles that are inside the pelvis, the pelvic floor, connect from the front of the pubic bone back around to the tailbone sacral area. Their job is to support the organs. So anytime things aren't working well, where we're having pain or dysfunction down here, peeing your pants, prolapse, those type of symptoms show us that these guys are not working well. So my job is to figure out if the muscles are tight, then we've got to lengthen them. If they're weak, then we need to strengthen them. And we need to also make sure that those muscles are coordinating together. We want to make sure they're working together as a team, because if not, that's where we can have poor coordination and dysfunction. And then we also want to make sure that this area, the diaphragm, pelvic floor, lower abdomen, and back are working together as a team too to help keep you stable during your functional mobility. That's awesome. Why has no one told me about this sooner? Pelvic floor physical therapy has been around for a while, but people just don't know about it, or we've kind of lived in an environment where things are kind of hush-hush, and now people are starting to be really more open, letting their friends know what's going on, letting people know that it's not okay to suffer in silence, that if something's going on with the tissue down there, then they need to seek help, which has been phenomenal. And if your provider hasn't told you, it's recommend to your friend that maybe they should advocate for themselves and ask the doctor if it's okay for them to have a script for physical therapy. Or in some states, you can even seek out physical therapy help for the pelvic floor muscles without needing a referral, which is pretty awesome. Like, you can go ahead and schedule online. And you can do that at our clinic too. So it's pretty great. You can go online. There's a button that says book appointment. Open it up, find the time and day that works best for your schedule, and go ahead and book that appointment. It's almost the end of the year, folks. So if you've met your deductible, great time to come in and get things checked out. Or if you're having issues, it's also a great time to decide that, your life matters too, and we got to get your health back on track to help your future self. That's great. So what all does this entail? I've kind of read some things online on Google, and it makes me really nervous because I hear of things like going in there and shocking, and I don't know, I'm just not ready for that. And I've been doing Kegels. I've heard about Kegels. I heard the Kardashians were doing Kegels. And honey, the Kegels have actually, I think, made things worse. I'm actually peeing my pants more. So Kegels, they're just not working for me. Great question. It's different for everyone. Everybody has a different journey, a different story on why these muscles are behaving a certain way. Yours pelvic floor might be completely different than mine. Or to the person next to you. We really need to assess that tissue, see what's going on. For some people, we can do an internal pelvic floor muscle examination, similar to the gynecological visit, but there's no speculum, no stirrups. What we're doing is assessing the muscle tissue inside. For vaginal issues, pain with intercourse, urinary leakage, we'll do an internal assessment where we are using one gloved hand. We'll insert into the vaginal canal. We'll assess that tissue, the different layers of tissue, the right side, the left side. We'll look at the strength, the endurance, how it's contracting and relaxing, and other things that might be going on down there, like if scar tissue is an issue from childbirth or from other surgeries. We definitely want to look at that. We will also, I want to tell you that Kegels aren't always the answer, and majority of people aren't doing Kegels correctly. So we'll be able to assess that as well. I'm going to walk you through everything that we do and everything that I find, and if at any point that you want to say stop the exam, you could do that. Or if you have any questions, let me know. But most often, I will be using my hand, my arm, to talk to you how that tissue is working. Because tissue in the pelvis, it's muscles. They're going to behave like other muscle tissue. And just like your arm, you can see it contract, you can see it relax. We just can't see the muscles do that. So my job is to help kind of create the picture for you of what's really going on, make you more aware. So as we're doing the internal muscle examination, I'm going to tell you, if your tissue is sitting more tight, if it's completely relaxed, how it's moving during the contraction relaxation. Great. And I just had a baby like 7 months ago. Can you check me for that abdominal separation thing? I mean, when I checked myself, I had like a 4-finger split, and that just freaks me out. It's like every time I come to lean up, it looks like an alien's about to pop out of my belly. Absolutely. So when we do the assessment, I'm also going to look at the abdominal cavity. So we'll check out any kind of scarring that you've had, gallbladder surgery scars, appendectomy scars. If you've had a cesarean, which it looks like on your paperwork that you've had a couple, I want to assess that tissue. I want to see how it's moving. I want to see how the whole abdominal cavity is moving, if there's any restrictions. But what I also want to see is how you're breathing in that abdominal cavity and what the diastasis looks like. And not a true diastasis that you feel like things, if your four-finger split is 4 fingers, we'll check to see if that's really true, if there is a 4-finger gap. But I'm not worried about the 4 fingers. I'm more worried about the depth of the separation. Because if it's 4 fingers and it's nice and tight where you can't really push down, way to go, girl. That functionality of that tissue with movement, if we can push in and not really go anywhere, that's great. But if we can improve, if you are more weak, have more of a depth to that, then we want to improve the tension in the linea alba, that tissue that is part of that separation of the rectus abdominal muscles. And it could be, caused from some tightness in that area too. So we'll take a look at the whole system, and then we'll try to figure out which puzzle pieces kind of need to be fixed first to get the whole system really functioning well again. All right, cool. Can I use the bathroom first before we go pushing on my belly and everything? Absolutely. I'll have you go use the restroom. You can come back, and before we get started, we'll do an assessment to see how posture is working, how the muscles are really functioning with, the lower extremities as well, because we could see some imbalances in standing with squats, that type of thing. And then we'll do the internal muscle examination. So I'll have you change from the waist down. You'll cover up with a gown. And as long as I have your consent to move forward with that, which you've signed the paperwork, which is fabulous, we have no issues. We'll get going. If at some point, again, if you want to stop the examination, just let me know, okay? It's all up to you. Great. Thank you for explaining it to me. Hey guys, it's Amanda. A lot of people have so much fear around a pelvic floor physical therapy assessment or an examination, and there really is no need to be. It's very gentle. It's very, I love bringing the awareness to patients and to women to let them know, like, hey, this is your tissue. We all live with it. We mess with it every day because we urinate or have bowel movements. For a lot of us, we've had periods, and you have a vaginal canal, things are coming out of it, but we still know very little about this area. So our job as pelvic floor physical therapist is kind of to paint that picture for you, give you a better understanding, decrease any fear that you might have. So within your examination, please tell us all information, especially on the paperwork and in person. Don't be afraid. Nothing is TMI. We need to know all the facts so we can give you the best case scenario for a plan of care of going forward to help you get rid of your pain or to help improve your leaking with jumping activities. We need to know everything, all right? So if you have any questions, shoot me an email, amanda@empoweryourpelvis.com. You can find me at empoweryourpelvis.com, or you can also find me on social media.